Right, everyone. Now we are going to dive into dual relationships and what that means for the massage therapy office. As always, for the professionalism class, while we do pull from other sources, I will encourage you to read chapter 2 in this one from your Mosby's Fundamentals. We're using the 8th edition. All right, so what are dual relationships? This is the overlapping of professional and social roles and interactions between two people. It's a natural aspect of human interaction. Maybe your dad is your dad and he's also your soccer coach. They hold the potential to enrich our lives, but they also hold the potential to cause great pain. All right, with mature self awareness as a professional and making responsible choices, the ethical practitioner can safeguard the therapeutic relationship and enjoy appropriate overlapping connections with clients when it's safe to do so. Dual relationships can enhance the therapeutic relationship if and only if clear boundaries are maintained. So, a dual role exists when scopes of practice overlap each other and one professional provides support in more than one area of expertise. It might also occur when personal relationships overlap with professional services. Are you massaging your friend? Does she come see you as a client and is also your friend in your personal life? Are you massaging your boss? So she is your employer while you are at work, but then she is your client in your office. Dual or multiple roles develop when professionals assume more than one role in their relationship with their clients. And these roles develop in many ways. Providing massage in the professional environment for family members is a classic example of a dual role, as is providing professional services for a personal friend, right? Usually, when we're in school, we start by massaging our family and friends before we branch out, get employed, or start our own offices. So, this is a way that dual roles start beginning in your professional massage therapy life. All right, so there are some things to evaluate that might cause risk. What is the intimacy level? Is this someone that you're extremely intimate with in your personal life, maybe a best friend? And are they going to try to be that intimate in the massage setting? What's the impact of the power differential? If your boss is someone that likes to always have the final word and have their way, are they going to be comfortable with you having any semblance of control in the massage therapy office and outside of that work environment? To what extent does mutual and equal consent exist? Can you say no to massaging your boss and keep your job? Are you being forced into being into a dual role or dual relationship? Who is accountable for what in the relationship? Your massage therapy relationship as a professional needs to be separate from how you interact with them in your other role. What is the relative maturity level? Will the therapeutic nature of the relationship be enhanced, hindered, or unaffected? And what are the consequences of non participation? What's going to happen if you say no to being in one role or the other? If you tell your boss no, you're going to lose a client, but if you tell her no, are you also going to lose your job? Right. Dual and multiple roles are difficult to manage in the professional relationship and can be a breeding ground for ethical dilemmas. Managing the inherent power differential of that therapeutic relationship is difficult enough without increasing the likelihood of transference and countertransference, which we just talked about, or the breach of professional boundaries by assuming dual and multiple roles. A dual role can also arise in more subtle situations. The sale of products to a client, all right? Now you are trying to sell them goods. Okay, remember we talked about this in power differential. They may feel overly pressured by your position of power as the massage therapist to sell them this good. All right, bartering of services. There's an interesting story about this. Bartering can get you in trouble because if you're not bartering for the monetary value that you have set for your time as a massage therapist, things can go sideways. There is a massage therapist who was bartering services for construction work. The person did not show up and do the construction work, and when they did finally show up, they did a terrible job. I don't remember exactly what happened, but let's just say it cost them over $1,400 to repair whatever happened in this kitchen. I can't remember if the cabinets fell off or it was flooding, but the therapist was out a lot of money and then refused to keep massaging the construction worker for obvious reasons. The construction worker got really angry because they had been promised a set number of hours of massage therapy for this work. The massage therapist said no because now the work was not only not getting done, now they had to pay $1,400 to repair what had been done to their home, and the whole thing got ugly and had legal ramifications. All right, so things can go sideways really, really quickly with dual relationships, especially if it's not someone that you have a strong personal connection to outside of the massage therapy office. All right, excessive personal disclosure by the therapist to the client. If this is a close friend or family member, they might not respect you as a massage therapist because they know too much stuff about you in your personal life. Shared social interactions or shared professional services, these all create situations in which the power balance of the therapeutic relationship can become problematic. As in all ethical dilemmas, decisions about conduct are gauged against the client's welfare. This is a client-centered business. You are focusing on the client's benefit at all times. It is your responsibility to maintain professional boundaries at all times, and it is up to you to keep the client's welfare at the forefront of every decision that is made. So there is a very particular type of dual relationship, and this is called sequential relationships. This is when one set of roles completely ends before a different set of roles begin. So say you are in school as a student and you have a teacher who is teaching you, and then during the week they come into the massage clinic and now you are massaging them. In the clinic setting, your clinic teacher is your teacher, but the teacher who is your normal teacher for another class is now your massage client. That is a dual relationship. Now, if you were to graduate from school, that teacher used to be your teacher is no longer your teacher. They come visit you at your place of employment. They are now your massage client. This is a sequential relationship. They were your teacher. They no longer are. Now they are your massage client. It is different than being both your teacher and your massage client simultaneously. All right, so what are some factors that indicate an increased risk of harm if the relationship turns personal with dual relationships? If you are a key figure in the client's life, if this is someone that does not have a lot of friends or family or support systems or internal resources or external resources, and they have started to rely on you, okay? They've let the situation become too interdependent, and they are starting to focus on you for support in more ways than one. If the practitioner talks to the client about the client's personal life, relationships, and psychological struggles, not just physical issues, you're going to get tired of me saying this, but you are a touch therapist, not a talk therapist. There is a significant emotional involvement or dependency. Maybe they're going through the same type of struggle you are. Maybe you both were married to somebody with cancer. Maybe you've both personally had cancer. Maybe you both have suffered the same kind of loss in work and family and life in some type of way. And this has trauma bonded you to your client in some type of way. The practitioner breaks down his or her own rules with the client. You have crossed your own professional boundaries or personal boundaries with this client, and this is an issue, okay? This is going to create a very large ethical dilemma with this dual relationship that you have. And a final note, dating former clients. All right, we've already talked about sexual intimacy, needing to wait 6 months before you attempt to date or have a sexual relationship with a former massage client. And again, remember the practitioner is fully accountable For all behavior, no matter who initiates the relationship, the therapist is the one that's going to get in trouble. All right. You hold the risk of the therapeutic power dynamic continuing. You start dating somebody and they still keep acting like that power differential is there, that you are the massage therapist forever and they're coming to you for your knowledge or your expertise or your advice rather than truly just dating. There is still an issue potentially of transference and countertransference and not having a clean, open relationship. There might be some client vulnerability because they still feel that you're slightly in a position of power. A damaged reputation. You might be seen as someone who sleeps with their clientele. And of course, that leads into the strengthening of old negative stereotypes about the profession, about, massage being a cover for prostitution and other things of that nature. So please keep that in mind. Keep it completely professional and make sure that you break it off and keep it clean for at least 6 months before pursuing a relationship with any of your professional clients.